Assalamu alaikum, Amina. How are you? I'm anxious to get Ramadan. Here it's less than probably about 15 days before our whole holy month starts. So I just wanted to have a brief conversation with you, sort of get your point on a few things that, I've run across and wanted to get your feedback on it or an Islamic point of view. So,
Sure.
as American Muslims, we've all, are impacted by Islamophobia. Can you tell me like what it is and what its origin is, please?
Sure. Islamophobia is defined in a number of different ways. One of the most simple understandings of Islamophobia is anti-Muslim racism, like many other racisms. And in terms of, its origins, its history, unfortunately, Islamophobia does have a long history dating as far back as the Crusades, when Muslims were viewed as infidels, as violent, and as the enemy to be feared and hated. And these stereotypes really continued under European colonialism and into modern times, which has led to widespread bias and discrimination against Muslims. And this is both in the United States and globally. And then, of course, 9/11 made the problem much worse because the media, television, movies, and social media now, among others, have really spread negative narratives about Muslims that have been widely accepted in society.
So I know this carries over into healthcare, healthcare settings. So what types of discrimination have you observed or heard about that Muslim Americans, access healthcare when they
Well, I mean,
access it?
since doctors, nurses, and hospital staff are exposed to the very same things that other people are, the way that Muslims are portrayed in popular culture, some of the reporting about Muslims, it really shouldn't surprise us that these prejudices also show up in healthcare settings. So, for example, doctors and nurses may assume that a woman like me who wears hijab is oppressed or not in control of her body or not in control of her life and her life decisions. Or because the image of Muslims is as terrorists, they may fear Muslims with fear or with hostility. And in fact, there was a 2015 survey done about Muslims in the healthcare setting that found that almost a third of Muslim patients reported that they had experienced some form of discrimination in healthcare settings. And it was a little higher for people who wore some kind of Islamic garb, like a headscarf or some identifiable visual form of Islamic dress. And additionally, more than half reported that they felt excluded or ignored, standing in line or waiting to be served. Additionally, 2 out of 5 Muslims reported problems related specifically to wearing Islamic dress, such as doctors or nurses not recognizing the importance of wanting most of the body to be covered during a procedure, or leaving the door open while a patient is not wearing a headscarf or a long sleeve shirt. And then more than a third reported offensive or insensitive verbal remarks, such as discouraging a Muslim patient from getting pregnant, or being accused of experiencing abuse in the home. In fact, one patient reported that a doctor who they went for the first time to meet said, "Oh," when she saw them and didn't accept them as new patients. And she also reported other times they were treated in an unfriendly way. So this does cover diverse groups and people of the Muslim background and their different experiences. And it's not just women in hijab. So I don't know, Manisa, have you had similar experiences when accessing healthcare?
Personally, I have not, but I have taken an elderly, female relative who does wear hijab to the doctor's office. And, she said when she went into the examination room that they were a little off. So, then I did speak to somebody afterwards about it. So, that was my experience, but what sort of suggestions do you have when a Muslim patient, how should they respond when they're experiencing this, Amina?
Well, if you experience this type of treatment in healthcare institutions, I think the most important thing to really think about is that instead of reacting angrily or doing something that makes the situation worse, you really consider what our religion teaches us in terms of patience, kindness, and forgiveness, because it's quite possible that these words or actions stem from a lack of knowledge about Islam and Muslims. So it's really important to view this as an opportunity to educate them. So, for example, you can explain the importance of hijab by saying, I view my headscarf similar to the way that many other people might view their pants. And so it's important for me that I keep it on, even though I might be doing a procedure that requires exposing other parts of the body. Or if you feel like you're being ignored while waiting in line, you can gently but firmly say, excuse me, I've been waiting here for a long time and I've still not been called to the front desk while others have gone before me. But then, of course, if the provider continues to ignore your requests, you could actually ask to speak to a supervisor or even consider finding another provider, because if you can't educate them or influence a change in their behavior, which really should be your primary goal, then you should report it, because we also want to make things easier for the next Muslim who needs care.
So what are some common issues or concerns that you've heard about, Amina, that come up for Muslims when they are asked about, medical help and medical care in the US?
So one of the kind of overarching concerns for Muslim patients is that oftentimes, or they are afraid that oftentimes, healthcare providers may not be familiar with Islam or the culture of the country that they come from if they happen to be immigrants. And this impacts many of the issues that come up, both when visiting a doctor as well as during a hospital stay. So specifically for community members, general issues that come up when visiting a doctor could be a language barrier, modesty and gender interactions, and this is for both men and women, or concern that some medications may contain prohibited substances such as pork or alcohol. And then, of course, there are additional concerns that arise during a hospital stay, such as food restrictions, religious rituals, such as praying and fasting. And then for women giving birth, issues relating to labor and childbirth. And then, of course, end of life issues have a host of issues as well. For some of these issues, we don't have to recreate the wheel. So issues such as language barriers are similar to other immigrant groups with similar solutions. So for example, if you have limited English fluency and need translation, you can request a translator or request that healthcare providers speak slowly and clearly and use more simple language. So I don't know, Manisa, if you have any other challenges that you've experienced or noticed, with other friends or relatives.
Well, personally, I know when I was, before I gave birth to my daughter, when you have the hospital tour, I had made sure that when I did come in, that I would have an all-female staff if I could, because of those reasons. So those were some of the issues, and some of the ones you brought up. Can we look at them more closely and what your suggestions might be? And let's start with modesty and gender interactions. What are some challenges for some, female or male Muslim patients?
Sure, yeah. So one of the major cultural barriers is around modesty and mixed gender interactions, which impacts Muslim patients. And this is both when they visit the doctor as well as in the hospital. So some Muslims, and this is both men and women, are uncomfortable even touching the opposite gender, even shaking hands, which of course during the pandemic, we all were uncomfortable shaking hands, but people may or may not go back to that. Additionally, because of that sensitivity, as you mentioned, many Muslims, and this is both men and women, do prefer same gender doctors and nurses. And it's particularly true for OBGYN or any kind of personal care, such as bathing, catheter insertion, etc. And then, as we kind of alluded to, Muslim women may want to stay covered even during a procedure, which may not seem to make sense, but their attitude is, we want to only uncover what is necessary. So that is a patient's right to do so.
Okay, so what are some ways that Muslims can make sure that their practices around modesty are respected and, when they visit the doctor or the hospital?
So there are many ways that, a patient can really ensure modesty during medical procedures, even in front of same gender providers. This is an issue for many Muslims as well. So for example, you can request that they close the door or use privacy curtains or both, You can ask for a larger medical gown that covers more of the body. You can also request, as I mentioned, that only the parts of the body being examined be uncovered and that they're recovered as soon as possible. And this is particularly true, of course, around the private parts, which for observant Muslims include between the navel and the knee. For men and for women would also include the chest. And then if you're uncomfortable being alone with opposite gender providers, you can ask for a friend or a family member to accompany you to the appointment. If you're a woman, particularly if you wear a headscarf and you're staying in the hospital, you can also request that male providers knock before entering your room. And I remember when I had my last son, I was staying in the hospital and I wasn't getting my snack. And it's because the nurses there had put a big sign on the door, no males allowed, which isn't really what I wanted because I did want to get my snack. It's just knocking before entering. So a woman can put on her headscarf.
Yeah.
So you said you didn't really have a lot of similar experiences when you gave
No.
birth because you had an all-female staff.
Right. And then even seems like every doctor that I do choose, I'd like to choose a female one, dentist, what have you, my primary care. So I just tend to stay with the female one. So it's a little bit more comfortable for me that way too.
Yeah, I do the same, but inevitably
yeah.
they're out of town. So of course, as Muslims, we know that medical necessity allows for, both males and females to offer the health care that is needed.
Yeah, so then that leads me to some, what would be some religious practices, Amina, that might be challenging for Muslim patients when they do get hospitalized, they can't do the same things like when they're at home. For example, if they're bedridden, what about, how do they do their cleansing before Salat, right? How do they do wudu? Do they ask a nurse to help them, or what are some challenges that you've seen?
Well, I've really seen three major areas: diet, prayer, and fasting. Those are things that really impact Muslims in the hospital. So let's begin with diet, which for observant Muslims means mainly avoiding pork and any pork byproducts, but that would also include things like gelatin and of course alcohol. And it's important to make note that they're written in your intake form. Additionally, many Muslims, like myself, actually only eat halal meat, which is not generally available in hospitals. You may as well. So it's important in that case to request a vegetarian or seafood or kosher diet. And then additionally, since some medications such as gel caps may contain or do contain for sure pork-derived gelatin, it's important to also specify that you want tablets. And then since some medications such as cough syrup and some mouthwashes contain alcohol, it's also important to proactively inform hospital staff that you only want non-alcoholic alternatives, which do exist. Another important religious practice, as you alluded to, for observant Muslims is the 5 daily prayers and the required washing before the prayers, which is known as wudu. It's translated as ablution, and it includes washing one's hands, mouth, nose, face, wiping the hair, washing one's arm and feet. And this should be repeated, of course, before any of the 5 prayers, after any bodily functions such as urination. So for a patient, if they're not able to walk to the bathroom, you can request that water be brought to your bedside. You could request help with washing. If your condition is such that contact with water would be bad for your health, you can actually perform what is called tayammum, which is a symbolic dry wash using a stone or sand, which you just pat your hands on, rub them together once, and then a second time and wipe them over your face. Then the second part of that is the religious practice known as salah, or the 5 daily prayers, which do occur throughout the day. And, as a Muslim patient, you can perform those prayers in your hospital room. You can use a clean towel. You can ask for an extra sheet, or you can use your own prayer rug. It is good to inform your nurse that although, privacy during prayer is not required, it is really desirable for concentration, and especially for a female patient, for reasons of modesty due to the physical nature of the prayer, which includes standing, bowing, and prostrating. It's desirable that they be in somewhat a private situation. It also, if you tell them about the specific times or around the specific times that you may be praying, it helps them understand why when they walk in, you're not responding to them, even though you could be praying sitting if that is needed, or even lying down for some patients. it may not be obvious that you are praying. I know when my dad prays, he prays sitting down. He's 94 years old. I can't always tell he's praying. So knowing that ahead of time is really helpful. And then the last religious practice, which may be challenging to observe while hospitalized, is fasting in Ramadan, which, as you mentioned, is coming up very quickly. And as sick people are not really required to fast, especially if they're seriously ill, many hospital patients will not even need to worry about this. But if, your condition allows you to fast and you've discussed it with your physician, you make sure just that you follow the guidelines that they recommend in order to fast safely. You'll also need to request some special arrangements for meals, since they are delivered at set hours. If you've ever stayed in a hospital, you know that. And those hours don't always align with suhoor, which is the pre-dawn meal, or iftar, which is the meal after sunset. And you'd also need to make special arrangements for treatments and medications, specifically oral medications, mouthwash, injections, or IV fluids for hydration or nutrition, all of which break one's fast. So, moving from, once or twice to, from 3 or 4 times a day for medications. And then there's other treatments such as eye drops or blood tests, patches, creams, or ointments. And then IVs or injected medications, which are solely medicinal, do not break the fast. I know there was a whole conversation about whether the vaccines break the fast last year, and all of the scholars said they do not. So when you're fasting, you can take a non-nutritive, IV or injection. And then there's some difference of opinion about nose drops, ear drops, inhaled medications. So it is quite easy to, inform your healthcare provider and change the scheduling around medications, as well as avoid any of these ones that would break the fast. So does it sound like I've covered most of the issues that come to mind, Manisa?
Yes, very, very comprehensive, Amina. Thank you. But while you've already touched upon, the modesty and the gender issues, are there any specific issues relating to women's health that you can tell me about?
Yes. So we talked about modesty, and because of a sense of modesty, many Muslim women, and women generally actually, may find pelvic exams, for example, embarrassing and uncomfortable. And Muslim men may feel the same way about exams of, their prostate or similar private areas. But issues relating to modesty do tend to impact Muslim women more, because they generally visit their OBGYN more often than men visit their primary care doctors. So if you have the preferences you did, you may request same gender care providers, and that's especially true for pregnancy, labor, and delivery. However, as I talked about, if a female physician is unavailable, there is a principle in Islam called medical necessity, which means that Islamic leave is allowed. And I remember that happened to me a few times. They're always on vacation when I go into labor.
Right.
But, a way to kind of handle that is requesting, again, to stay covered as much as possible and to limit the number of people in the delivery room, as well as to be notified if a male caregiver is entering the room, so that you can put on your scarf or other clothing, as I talked about when I was in the hospital. I don't know if you had similar experiences after giving birth, Manisa, or, with your...
No, it was just, my doctor was luckily the one that I go to, but the anesthesiologist, they were on call and it was a male, but luckily I was covered, and they were able to administer it without any, for me still being covered. So I didn't have any issues. But what about, speaking of, giving birth, having children, what about reproduction issues, Amina? Like, are there concerns that may be explained to healthcare providers?
Yeah, so with regard to reproduction, while most Muslims do consider birth control to be permissible, as long as it's a temporary method, so that would exclude permanent sterilization, for instance, they're considered unlawful because they're permanent, unless, of course, there is medical reasons, such as a health risk to the mother or to the fetus, such as a genetic disease. That would be an exception. It's also important to explain to care providers that fertility treatment and assisted reproduction is only allowed between a husband and wife during the duration of their marriage, using the husband's sperm and the wife's ovaries and uterus, which really means that sperm, egg, or embryo donations is not an option, as is not an option to have third-party surrogacy. They should also inform care providers that additional embryos produced by IVF, in vitro fertilization, between the husband and wife should be discarded or donated for genetic research, but should not be used for procreation. And I actually have a relative who, after going through IVF and finding out it didn't work, the doctor goes back and said, well, what about, donor sperm or, and it's as if they hadn't made note of it. And it can be very painful for the person who is going through this. So it really is best to inform providers of all of these limitations up front at the beginning of treatment so that they're not brought up as an option. And I don't know if you can think of any other challenges that you've experienced or other people have experienced with regard to reproduction.
No, but I mean, surrogacy is becoming very popular. And I think you explained that, that's really not allowed then in an Islam.
Yeah, I mean, it is obviously a bit of an interpretation. So there may be
Right.
some slight variations to my understanding, but I think generally it is viewed as between a husband and a wife for the duration of the marriage where it's allowed.
Okay. Well, let's move on to something that's been increasingly, I think, especially since COVID has come about, is mental health. Everywhere you turn around, at work, there's mental health, workshops or seminars coming up, and in schools, I know the children that they have counselors that they talk to now. So what are some specific mental health issues that might be experienced by Muslim Americans?
Well, of course, Muslim Americans experience many of the same daily stressors as other Americans, juggling work and family, raising children, the pandemic. And then for immigrant Muslims, who make up more than half of all Muslim Americans, they are also impacted by events such as wars or conflicts in their home countries, the same way, Ukrainians are going through that right now. We've had the same experience for Syrians, for Iraqis, for Yemenis, for so many other groups for many, many decades. Or they're dealing with the challenges of a new culture, a new language, especially if they're newer immigrants. And then additionally, they may be experiencing discrimination at work, or their children may be experiencing bullying at school. There's been a few polls about it. 2020 poll found that 3 out of 5 Muslim Americans experience religious discrimination, which is as high as discrimination against Jews, but maybe not reported as often, mainly because Muslims may not be as likely to report it. And of course, this discrimination does take a mental toll and can even result in poor health, feeling less safe. And this is especially true for young Muslims who are really at greater risk of discrimination-related stress and more likely to internalize Islamophobia or anti-Muslim racism because they are younger and still searching for their identity. And then, as you mentioned, the COVID pandemic and associated stressors, social isolation, being at home instead of at school, have also led to a rise in mental disorders in the Muslim community as they have with the general public. So I don't know if you've heard of any specific issues in your community, your local community, or the larger community.
Nothing in my community. A few of my neighbors mentioned that, they have grade school children at that, and then they were getting more like counseling for mental health issues, especially last year when they were all, didn't have in-class participation, was all through Zoom. So they more than, but it's still an issue, they say. And then what are some reasons that might prevent Muslims from getting mental health care, Amina? And what can we do to address that?
So while the pandemic and also the rise in just general awareness, locally, nationally, and even globally, and greater acceptance of mental health issues as just another part of overall health, there is still some Muslims who will hesitate to seek help due to a cultural stigma around mental health issues, a denial that, they really are there, that they impact a family member. And then additionally, some Muslims may fear that non-Muslim professionals may not understand their religious beliefs and values or give them advice that contradicts their beliefs. So, if you have concerns with your mental health provider, it is really important that you bring them up at the outset to ensure that they are culturally competent and will serve your needs. And then, of course, if you prefer to seek mental health care from Muslim psychologists and psychiatrists and therapists, there are a number of Muslim mental health organizations, such as Khalil Center, which is based in Chicago, and locations in New York, Los Angeles, Santa Clara, Toronto, Here in the Bay Area, there is a new organization called Veristan, which is based, I believe in the South Bay, but of course, a lot of things are on Zoom now. And then another outlet or option is to consult with your imams locally if they have experience with mental health or mental health training. That is really important to ensure that they have that before going to them. Some hospitals do have Muslim chaplains or chaplains who have experience working with Muslims. Like at ING, we do train chaplains from various faiths, so they may have a better understanding and be able to provide that spiritual care or mental care.
Good to know. So I have a neighbor who has a family member who is a recent immigrant, and they don't speak English too well, and the family members want to make their decisions for them. So what would you suggest would be the best way to get healthcare providers to accept those decisions if the family member makes those decisions because the patient doesn't speak English?
Yeah, so for immigrants, especially women who are recent immigrants and may not understand the healthcare system or don't speak good English and want their husbands to oversee their healthcare and even make medical decisions for them and want them to take that role, it is useful to convey that, again, to their healthcare providers from the beginning, because generally hospitals will want decisions to come from the patient. And so it's important that the family lets them know that the patient wants them to be involved in their care, even if the patient is conscious and able to conduct their own affairs. And Muslims often have extended family members living close to each other, or even if they're living apart, they're going to have strong family ties and still want to be involved. So while the decision-making process may involve all the patient's immediate family, it is best that they appoint one family member to communicate with the hospital staff after consulting with the rest of the family. And for example, my mother passed away. May she rest in peace. And my brother was the point of contact, but at every point he was consulting with us and then conveying that to the hospital staff. And then, of course, it's important to remember that many of these issues are more culturally determined than really religious, but many Muslims may assume that they're religiously based when in reality they're not. So I don't know if you've had similar experiences with any of your extended family members during hospitalizations.
My grandmother, but this was probably back in the late 70s when she was hospitalized. But my father or one of the family members was always there with her. And we would ask her, because, she was the one getting treated. And then we would convey that to the healthcare provider. But speaking of my grandmother, so like elderly parents who are immigrants, are there ways to get their decision process, like if a family member, if they were incapacitated or something, could they make those decisions then?
Yeah, so recent immigrants, especially elderly patients, may prefer to have their adult children make decisions for them. And so it's really best that they assign a medical power of attorney to them, which gives them the legal authority to make important decisions about their medical care. And then another legal document relating to decision-making is called advance directives, which state a person's wishes about receiving medical care if that person is no longer able to make those decisions for themselves, because of a serious illness or injury. And so that's another option. Both of these documents are religiously allowed and even recommended, as long, of course, as they don't violate any Islamic rules. The problem is that Muslims are often shy to bring up these issues. Any issues relating to death are just kind of taboo. And so it's not common to have these documents in place ahead of time. It is really useful, even though it is uncomfortable, to have these conversations, especially if you have, someone who is sick or elderly. It can save a lot of discussion and challenges later. So again, with my mother, at one point they called us and they were asking us to decide on what to do, go forward with more treatment or just go to comfort care. And then they actually told us, oh, it's actually in her advanced directives, no heroic measures, which made it a lot easier for us to go along with that decision instead of having to make it ourselves. So it is really beneficial.
Yes, I'm so sorry about your mother, Amina. May Allah be pleased with her. So this brings me to the topic of death and dying. What are some, end of life practices that healthcare providers might not be aware of? And how can Muslims make them aware of that so their practices are respected?
So again, this is a little more cultural. You will find that some Muslims may want to avoid informing a relative of terminal illness out of fear that it will cause them anxiety or even speed up their death. And so if as an adult child, you feel that it would be harmful for your elderly parent to know about a terminal diagnosis, it's important to explain your concerns to their doctors and work together on a solution. Another issue that might be challenging, since Islamic teachings do really emphasize the importance of caring for the elderly, and in particular elderly parents, is accepting care or hospice outside the home for your parents. And so one alternative, if you're able to, is to request in-home care instead and ask for medical support. And then, since it's really important for family members to be with their loved one at the end of life, requesting that extended family be present despite COVID restrictions. And that really ensures that all family members can be there at this critical time. And I do remember with my mother, initially they just said only one person or two people. And then at the last minute, they allowed all of us to be there, which was really, really wonderful. And so, if a family member is close to death, it's important to inform the hospital that it is highly desirable for them to be there, but also to bury their loved ones as soon as possible, either the same day or the next day. And that unless there's a legal necessity, to avoid autopsies because of the desirability to keep the body intact. So those are some of the major issues that come up.
Well, thanks so much, Amina. That information is so valuable, and I hope that you two have learned a lot from this. We also have a number of resources that may be helpful to you to learn more about this topic.